care for diverse patient populations with migraine, an exploration of migraine management with a focus on CGRP receptor antagonists. Today's program is supported by an educational grant from Pfizer. This CME activity is brought to you by CME Outfitters, a jointly accredited provider of continuing education for clinicians worldwide. You can also follow us on Twitter, now known as X, where you can find announcements for the future, continuing education programs, healthcare news, and more. As I mentioned, my name is Peter Goadsby. I'll be the moderator for today's program. I'm Professor of Neurology and Director of the King's Clinical Research Facility at King's College London and Professor Emeritus of Neurology at the University of California, Los Angeles, California. I'm very pleased to be joined today by an excellent panel who I'll now ask to introduce themselves.
Hello, good evening. My name is Cynthia Armand. I'm an associate professor of neurology at Albert Einstein College of Medicine, as well as the clinical director of the Montefiore Headache Center and the fellowship director of our training program. It's great to be here tonight with all of you.
Thanks, Cynthia.
Hi, I'm Dr. Susan Hutchinson, and my background is actually family medicine, but I'm certified in headache, and I'm director and founder of Orange County Migraine and Headache Center here in Irvine, California. And it's a pleasure to be with all of you.
Well, excellent. Thank you for introducing yourselves, and thank you, Susan. Our first learning objective today is to develop strategies to address unmet needs for diverse and underserved patient populations with migraine. We have some interesting data regarding the burden of migraine, which we hope to set the scene for the program today. I'm going to ask Cynthia to take us through that data and tell us what she thinks about it. Cynthia?
Thank you so much, Peter. So it's really important to understand this burden because when you see patients who come in with migraine, you can really understand what you see in the office and translate that to what's going on outside of the office because we see a snapshot. You can see here 1 in 6 individuals in the US are diagnosed with migraine. And actually 1 in 5 women in the US are diagnosed with migraine. Think about that in the demographics that you see in your office. Migraine is the second most common cause of disability worldwide. And when you're thinking about treatments and thinking about how it impacts individuals' daily lives, it's important to remember that. We do know that migraine affects individuals in their most productive years of life. And so it's important to see that fact there. 40% of individuals in these demographics do report at least one unmet treatment need. So think about that when you see your patients and ask at the end of the visit any extra questions, anything else, that it's important to seek that out. And then we do see here that in the data, about 26% of adult patients with